Hello, everyone. I'm Leonel August Rodriguez, the VP of Business Development for Access Medical Labs. I'd like to thank everyone for joining us on another Access Live, where we bring you insight from leading medical experts. We do ask that all questions are submitted via the Q&A, as they will be answered at the end of our lecture. Today's guest is someone truly extraordinary. He is a pioneer in functional sports medicine and human performance. He has worked with elite athletes, high performers, and individuals who, like myself, are always looking to unlock their full potential. From preventing injuries to accelerating recovery and optimizing peak performance, his unique approach blends functional medicine with science-driven strategies to deliver real, lasting results. Please join me in welcoming Dr. Ara Suppiah.
That's heck of an introduction. Thank you very much, Lionel.
Absolutely, my pleasure, sir.
Okay. Hello, everyone. This is an absolute honor and privilege. Our time is short, so I'm going to get straight into it, okay? I am a allopathic physician trained in the UK. Went to medical school at Liverpool University there, and then trained in general surgery, so board certified as a surgeon. Then trained in ER, critical care, board certified in ER as well, and then trained in sports medicine. And then when I started working with athletes, soon after I moved to the US, redid my residency in emergency medicine, got formally trained in functional medicine, and then I put all of those things together. I've also trained in culinary medicine with Tulane University, acupuncture, trained in Hamilton University. And so I blend a variety of specialties to help the athlete. My interest with the athlete has always been, when I trained in sports medicine, there was a lot of emphasis in treating people who were injured. And when I'd worked with them, not many of them were actually injured, but they had what I would call functional symptoms, right? Fatigue. That was my first question. Like, hey, doc, I'm feeling tired all the time. These were professional golfers in Europe. And they said, can you help me? So I did all the blood work that I was trained in allopathic medicine to look at, are they anemic? Is the thyroid, low? Are the iron status okay? Are they, so-called inflamed? That kind of stuff. And everything would come back normal. And I would tell the athletes, hey, your labs were all good. And they were like, how come I feel tired all the time? Or the other question I would get is like, doc, when I fly to China to play, and then, it takes me 4 days to get over jet lag, and by then the competition's already ending and I'm no fit state to play. Is there a quicker way to get over jet lag? Or the other one, very, very common, is like, my allergies are out of control. And I'm like, hey, can you try Claritin, Zyrtec, the usual stuff. They would start there, but invariably they'll be like, it's not, none of this is helping. Like, can you help me with something, right? Which is why I started exploring. I was like, something's going on that allopathic medicine alone is not helping me. So I was, okay, like, I discovered functional medicine purely by chance. I actually discovered cortisol and its effect on human performance first, and then started going down that rabbit hole. This is way back. This is before the internet was a thing. Like, I'm that old, okay? And eventually found myself in the US, then formally got trained with Institute of Functional Medicine in here at IFM. And then, like I said, put all of it together. My philosophy is very simple. It's based on a statement that Usain Bolt said about 10 years ago. He said, 50% of my training is rest and recovery, because I need to allow my body to absorb the training that I'm doing. Okay. So the first part of the statement, rest and recovery, like, made sense. But I question, like, why would one person be able to absorb training and another person not? Right? Like, what would impede with someone's ability to absorb training? And so from there, I identified, that essentially it's chronic inflammation. The more inflamed you are, the less you're able to absorb training. and recovery, right? So when you look at athletes, we think that, they just train a lot, travel a lot, and that's about it. But there's far more to it. The triggers for chronic inflammation are highly varied. And it's not just for athletes, corporate athletes, anyone, moms and dads, new parents, people who are going through a divorce, people who have bereavement, people who are moving house, all those stressful events. Essentially, the body looks at all of those triggers and responds in a predictable manner. Okay, so let's start there. So a trigger comes along and it challenges your baseline. We call that homeostasis, right? Challenges your baseline. So the trigger could be, say, lifting in the gym, or let's say you went for a long run. It puts you out of homeostasis, and then you respond. It initiates a response, which is a form of adaptation. Okay. Now, if you then, if you ran 5 miles, that's a one-off thing, the trigger's removed, you reestablish baseline. But let's say you're training and you're training hard on an off-season block like an athlete. Like right now, I just spent 3 weeks working with one athlete. We were doing training 2 a day, really intensely for 5 days, 2 days off, 5 days on, like for 3 weeks, right? Now, that trigger is not being removed. Okay. In this case, it becomes an allostatic load. So the first one, the response, see the top one here is allostasis. That's a physiological mechanism, right? If you remove that, you reestablish homeostasis. But if a trigger persists, so this could be, lack of sleep. This could be allergies. This could be medications, right? If the trigger persists, you end up with what we call an allostatic load, which causes some primary metabolic imbalances, which I'll show you in a minute, okay? This is not the disease state yet. This is the dysfunctional state, okay? So this is where you will get athletes who are saying, I just feel tired, or I've got brain fog, or girls will say, my body just doesn't feel right. My gut doesn't feel right, right? It's nothing pathological yet, but something's off, okay? At that point, depending on your tendencies, let's say you have a strong family history for diabetes or strong family history for psoriasis, you'll end up with a secondary metabolic imbalance, which leads to disease. Okay. So if you can follow that path, it starts with the trigger. This is really important. So whenever I start with an athlete, my first conversation with them is asking a whole bunch of questions to identifying triggers. I go all the way back from at gestational, what was your mom's pregnancy like? What was your childbirth like? Were you in NICU? Were you given antibiotics? Were you a preemie? Did you have colic as a kid? Did you have multiple antibiotics? Did you have, appendicitis? Did you, all those kind of questions, right? And then if you notice that the primary imbalance, if you don't address this by removing the trigger, so what's driving all of this is the trigger right at the top here. So if you want to stop this, you need to identify the trigger and remove the trigger. Sometimes the trigger is deliberate, like a training block. We want the allostatic load. In this case, the primary metabolic imbalance will initiate a physiological response that we want. That's an adaptive response, right? This, when it becomes secondary metabolic imbalance, it's maladaptive, okay? So the primary metabolic imbalance itself becomes a trigger and keeps driving this circle over and over again if you're not careful. So what are these allostatic triggers? So these are the major categories. So if you look at here, overuse injuries is one of them, right? Recent trauma, nutrition, oftentimes is undercaloried, but over calories too. And then there's always some new diet fad that they're working on, right? And then if you look at things like this, medications. So things like chronic use of anti-inflammatories has an effect on the mitochondria, which has a profound effect as an allostatic load and trigger on here, okay? But of all of this, and then look at here, this allergies here, environmental is travel, thermal, so excessive use of, like nowadays, a lot of ice baths, right? They're overdoing it, a lot of people, right? Or saunas, overdoing it. This literature is very clear about how much of that you really need. Beyond that, it becomes pathological. It becomes an inflammatory trigger. You're not getting the benefits anymore, right? But of all of this, the psychological trigger is the most profound. Why? Because most of these other ones are short-lived. You know, if you had surgery, you'll recover from it. If you were exposed to cold, you'll recover from it. If you're on medication, you stop it, you'll get better, right? But things like anxiety, depression, loneliness, guilt, lack of sleep, even when you are asleep, it is running the show. Like guilt will be running the show. And so this allostatic load, the trigger, initiates the same response. It doesn't care if you are, going through a divorce or you lost, $500,000. It doesn't matter. The response is exactly the same and it's predictable. All right. So these are the triggers. And like I said, I told you about this, okay? This trigger drives this whole thing to cause primary metabolic imbalance. Now, what are these primary metabolic imbalances? Well, I discovered that the primary metabolic imbalances effectively works into these 5 categories, okay? If you look at that, under energy, there's oxidative stress, there's fat oxidation inhibition, mitochondrial dysfunction. Under hormones, there's a whole variety of things. Under detox, oxidative stress again comes up there, right? But the inability to detoxify is also an issue. Immune dysfunction, when the gut, 75% of the immune system lives in the gut. Now, if your gut doesn't work, you're going to have massive issues there, all right? And so the triggers will cause all of these issues to go on. Now, it can pick one over the other, depending on your genetic tendencies or your lifestyle, but it can affect all of them together as well. So if you go from brain fog, so you can have brain fog here, memory is not very good, getting coughs and colds oftentimes because the immune system is not very good, breaking out in acne, skin, not great because your toxicity is building up, your hormonal dysfunction, so menstrual cycles could be irregular, men will feel that they can't put mass on, they're putting on body fat, and then you feel tired all the time and you can't really sleep. So you could have the whole gamuts there, right? And from here, what I did was I created, hang on, let me see. This. So from here, I created what I call my triangle. This is my functional sports medicine matrix, which I put together in 2016, which is basically the same exact model I look at every single athlete. When I first see an athlete, when I worked with the athlete for 10 years, this is the same exact model, okay? So it's a triangle. It starts off with chronic inflammation. Like I said, chronic inflammation is going to inhibit your ability to absorb training and recovery, right? On top of that, chronic inflammation, the triggers will cause dysfunction in those 5 areas here, okay? Energy, immune, detox, hormone, and then also your skeletal system. That's not what I mentioned earlier, but that's a key area. So any muscle imbalances, joints that are out of place, compensation in movements, all of those things, okay? Now, what's interesting is the green area here, these segments here, they drive chronic inflammation. Okay, so for instance, if you have a skeletal disorder and you're in pain, chronically inflamed, that's going to affect your sleep, which is going to affect your hormones, which is going to affect your energy systems. So they are interlinked. We don't look at, I look at it as a biological system. Although I study the individuals, it's a system, okay? And similarly, chronic inflammation drives those things, but those things can also drive chronic inflammation. So it goes up in the cycle. Remember that where the trigger and then the primary imbalance and it causes to feedback, that's what's going on there. Now, ideally, performance and recovery sits on top of this, okay? And the idea is if you can really keep chronic inflammation at bay and have really good, energy pathways, all the other systems are working well, that's the platform on which you can put training, recovery, and resilience. Now, if you can train really hard, absorb the training, and then recover from that training, you can train again, right? without getting injured or sick. And then you can keep doing that. If you keep doing that, you'll become resilient. That's resilience. Great athletes, great competitors. They are highly resilient people. Okay. And that's the basis on which athletic performance sits. Okay. So most people, we focus on athletic performance, but to me, all of this is going on the underside. That athletic performance is just the tip of the iceberg. And this is governed by your environment, your genetics, your epigenetics, and your environment. Okay. Now, watch. If I increase, if for whatever reason the allergies will go up, or someone's got a trigger that's driving chronic inflammation. If chronic inflammation goes up, your ability to absorb training and recovery and resilience goes down, and your performance will drop. Okay. What are the symptoms of chronic inflammation? Like in the hospital setting, we all know it. Okay. It's fever, body aches, signs of an infection, the cardinal signs, right? Red, swollen, painful, loss of function, right? Those are the cardinal signs. But chronic inflammation is slightly different in different settings. So for instance, in an athlete, a slowing of the reaction time, if the coach says, something's off with my player, like he's just slower, he's just half a step slower, that could be a buildup of chronic inflammation. Okay, increasing body fat could be a sign of buildup in chronic inflammation. Loss of willpower. Well, why would that be? Well, if you have a buildup of chronic inflammation, your testosterone will often go down. And men and women both need testosterone because it affects the frontal lobe, and that's where willpower comes from. So you'll notice things like that. Brain fog, fatigue, look at this, allergies going out of control, general aches, joint pain. So it's extremely diverse, right? Like all of you here would have seen patients with some of this. So the symptoms that suggest chronic inflammation is wide. You always have to be on the lookout for it. But what I'm looking for is a change. Okay, if someone is always got slow reaction time, or always have brain fog, that's not the new change I'm looking for. I'm looking for someone who suddenly says, I don't feel right. Like, I'm just so foggy, or they say, all of a sudden out of nowhere, I'm bloated, like my gut doesn't feel right. Or like, man, I put on like 5 pounds and I just cannot shake this off. Right. Those are when I start thinking, well, is chronic inflammation building up beyond what they're used to? Right. From there, I want to discuss, okay, so for each one of these areas, right, chronic inflammation, energy pathways, immune, detox, hormones, skeletal system, recovery, resilience, training, for every single one of this, I have biomarkers, blood markers, saliva markers, urine markers, stool markers, wearable device, as well as other ways I measure them, right? I measure every single component of this. And if I were to cover all of that today, it'll be way too long. So I'm just going to focus on chronic inflammation, what I look at for chronic inflammation. I do a whole course on this. If you're interested, I can send you more information on it. But I teach practitioners how to do all of this, right? But chronic inflammation, to me, I don't just look at CRP. And here's why. So I had a patient. I was working in the ER. I still work in the ER. I'm an ER physician. And this guy comes in, and it's been like 5 or 6 days where he has an abscess on his forearm. It's red, it's painful, it's warm, it's tender, can't move it, right? And it's swollen. All the cardinal signs of inflammation, okay? And it's a week old. We do his labs, and this was way back. I was still in the UK then. And somehow we don't normally do it, but we sent a CRP. And the CRP was normal on this guy. And I, for the life of me, couldn't figure it out. So I asked my boss, I said, hey, why is the CRP normal? There's no way this guy's CRP should be normal. And my boss didn't know, and years later, like looking into it, I find out that CRP is a surrogate marker for interleukin-6. Okay. And the interleukin profile for inflammation is very, very individualized. So it varies. You know, just like there are kids who will be very sick with tonsillitis and have a fever of 104, or there'll be kids with same tonsillitis, bad, but no fever, but they look lethargic, they look terrible, they just don't mount a fever, right? So along those lines, you may produce interleukin-8, interleukin-9, maybe not so much interleukin-6. So if you just go by CRP, which is a surrogate marker for interleukin-6, you're going to miss this. So you're going to have you're going to have an athlete or a high performer coming in with symptoms, and if you just ran CRP, it won't be enough. So what I do for chronic inflammation is, over the years, I realized there were multiple other markers that help with this, okay? These are my 5. There's actually more than this. There's RDW, there's a whole bunch of them, okay? But let's focus on this one. CRP, I already told you, right? So this is what it looks like in the lab here, CRP. It is a surrogate marker for interleukin-6. If it's high, it tells you that there's chronic inflammation. But the question I will ask is this high by design, or is this high by pathology, right? So what do I mean by that? Let's say someone has just come in from a long haul flight. They played in Riyadh, they went and played in Adelaide, now they flew back, they had a long stop in LA, and now they're in Orlando, and I see them. And I did the bloods then, because that's the only day I could draw their bloods, okay? And the CRP comes back at 2, 3, 4, whatever it is. I'm not going to act on that, because there's been a huge allostatic load on that patient. There's been a huge trigger. I expect the CRP to be elevated, right? Similarly, like that gentleman I told you, the other the athlete I spent 3 weeks with, 2-a-days, meaning high intensity working out in the morning, heavy lifting in the afternoon, 5 days in a row, 2 days off for 3 weeks. Brutal. That CRP will be elevated. If it's not, I probably didn't train him hard enough, right? So just looking at CRP out of context doesn't help me. So an elevated CRP is not there's no moral judgment. It's not good or bad. It just is, okay? You have to interpret that high CRP based on what's going on around them. Now, let's say an athlete does that, CRP should not be elevated, and it's elevated, then I'll be like, okay, do they have a food sensitivity issue? Do they have gum disease, or do they have a gut infection that we're not picking up on? Or, why is this high? That's when I'll chase it, right? But let's say the CRP is high, not very high, like a little bit high, doesn't help me one way or the other. Then I'll look at the ferritin. So ferritin is an acute stress response marker. Elevated ferritin is also a sign of oxidative stress, which drives chronic inflammation. Okay, it is also an elevated ferritin is also a sign of acute stress and acute load on the system. Okay, so CRP is one, ferritin is the next one I look at. Then I look at homocysteine. Okay, again, this is a biomarker that a lot of people use for to look at heart disease. But homocysteine is a very interesting biomarker, because look at this pathway, right? Again, I teach this in my course. This is the pathway by which this is called methionine metabolism. Okay, so homocysteine is in the middle here. Okay, homocysteine should be converted to methionine, or it should go all the way down the path to form glutathione, which is a master antioxidant. Okay, when you have oxidative stress, it pushes homocysteine down the glutathione pathway, right? And it blocks conversion to methionine. Okay, but this whole process requires vitamin B6 and B12. Okay, so if you see an accumulation of homocysteine, so homocysteine is not being converted to methionine, it's not being converted to glutathione, then you can suspect like it's a vitamin B deficiency. But an elevated homocysteine could also mean there's a significant amount of oxidative stress going on, which is why it's also used as a biomarker for heart disease. right? So CRP, ferritin, homocysteine, okay? Those are, hang on, let me close this off. Those are key markers. I don't just look at CRP, okay, for chronic inflammation. So when I see this, I will look at someone and think, there's a significant amount of oxidative stress going on in this person. Or maybe that's a nutritional issue, right? Which is a separate test altogether. Hang on. The next one I look at is albumin. Now, albumin is a very, very interesting biomarker. Yes, it is a marker to represent the synthetic function of the liver, right? But albumin, when it is elevated, could also be a sign of chronic dehydration, like not just overnight because you didn't drink enough for the blood test. It's over a period of like 20 days. Okay. If you're chronically dehydrated, albumin will be elevated. Okay. A low albumin, though, is a sign of chronic inflammation. Low albumin. So I'm looking for elevated CRP, elevated ferritin, elevated homocysteine, and a low albumin. Okay. And then the last one, this is the one that most people don't know about, and there's a lot of work on this. If you Google search viral reactivation, and you'll see a ton of paper from NASA research labs. They will look at the white cell count differential. So not just the total white cell count. I want to know what's the ratio between the neutrophil and the lymphocyte count. Okay. There's also the neutrophil and platelet count, but for the ease, let's just go with neutrophil with lymphocyte. Okay. This ratio is very, very useful in predicting how an athlete is responding. Okay. So the normal ratio, neutrophil to lymphocyte ratio, should be 1 to 3. Okay. I don't even like 1. I like to see like 2 and above, right? 2 to 3. Okay. If this ratio is reversed or it's trending downwards, where the lymphocytes are starting to climb up over neutrophil, that is a sign that there is significant amount of chronic inflammation. This athlete is likely to be overtrained and they need to emphasize on recovery. So this one biomarker with their history, if it fits the picture, I will often tell them, I say, hey, listen, you need to cut back on your training. You need to increase your nutrition. You need to increase your sleep and really load this up. Otherwise, you are going to get sick. This was well documented during COVID, during the COVID period. NASA uses this to study reactivation, viral reactivation in the astronauts. I use this in my athletes. There are athletes who also demonstrate like certain times of the year, this ratio will start shifting, in which case we can adjust the load, maybe change your diet, add supplements in to address that issue. Okay. So this is something that's not often thought, not often discussed. It's right there on a CBC, right there. You just need to know how to look for it. Okay. So yeah, I don't just look at one marker. I look at CRP, ferritin, albumin, homocysteine, and the neutrophil to lymphocyte ratio. That's just to look at chronic inflammation in athletes. So I hope that's helpful. Like I said, if you need more information, I'd run a course. Please check out my website, functionalsportsmedicine.com. I'm not very active on social media. I do a little bit. That's a whole business on its own right, and I'm busy working, so it is what it is.
Awesome,
There you
Dr. Suppiah. I'm so sorry, sir. Didn't mean to cut you off there.
Yeah, no, all good.
Beautiful, incredible lecture here, sir. I have quite a few questions for you.
Yeah.
Starting with, I ran a poll and I asked the audience if they can let me know how many of them, so these are providers, how many of them have had symptoms or have had these types of triggers that you mentioned. 75% said that they personally have had these symptoms. I found to be, extraordinary. So please, everyone, take the opportunity to take down Dr. Suppiah's information. Incredible wealth of knowledge.
Listen, like I hear you guys. I've done, like I told you, I did residency in surgery, emergency medicine twice. Like sports medicine. Like I've been a residency. I mean, if you did this on residency, like every single one of those symptoms, residents have, right? So working in the hospital in the current climate with all those, patient satisfaction scores and this scores and that scores and meeting this metric and that metric, yeah, you're going to get that. Most of us are chronically inflamed, but it's looking for those biomarkers. That's key.
Absolutely. And since we're on the topic of the triggers, right?
Yeah.
So you mentioned certain triggers like diet, trauma, and lifestyle.
Yeah.
Now, how do you prioritize which of these triggers to address first in a
Okay.
patient that's facing, a multifaceted amount of issues?
Okay. Great question. So first of all, I prioritize the psychological ones. Okay. If they're having a tough time traveling because they feel guilty about leaving their family behind, if they're not sleeping well, right? To me, like when I give lectures, I always say this, like as a physician, I can prescribe anti-inflammatories, right? And the best anti-inflammatory to me, even for me, is sleep. It is by far the best medicine you can possibly have. So if you don't address that, you're not going to address anything, right? Number two, I look at, are there any nutritional triggers? Are they introducing new foods? Are they not eating enough? Are they going from diet to diet to diet to diet? Like, is something going on there, right? Number three, after I've seen that, then I want to look at, okay, you know what? Are there supplements, like overuse of supplements, overuse of medication? Like, can I clean that up? Because those are all the simple things. Beyond that, I look at the environment. Okay. Are they using ice baths too much? Are they using cold tubs too much? Are they prone to allergies a lot? Are they, are there house dust mites at home? Is the asthma flaring up? Do they have pets that, need to be groomed maybe better? Like, I don't know, whatever the environmental allergies, because the reason I do it those ways, it's A, it's easy to highlight, and B, you can do something about that.
Absolutely.
Right?
That makes complete sense.
Yeah. So, yeah,
And-
that's how I prioritize.
Let's talk about sleep, right? So this is that question that has been asked millions of times. What is the adequate amount of sleep that a grown adult, right, should be getting every night?
Okay. The answer to that question is whatever sleep that allows you to wake up refreshed.
Hmm.
Okay. Now, they've done a study where they put people in rooms where there were no clocks and no windows, and the people had no idea what time of the day it was. And they just studied them. They had like access to books and food and all this kind of stuff, but they had no idea. They deprived them of time awareness, right? And what they noticed, adults would naturally sleep between 7 to 9 hours.
Hmm.
Okay. Now, that is an average. Not everybody. I've worked with 9 world number ones, multiple Olympic gold medalists. Okay. I will tell you, they don't sleep 9 hours. A lot of them sleep 5, 6 hours, and they are high functioning people who don't get sick. But then you have like Roger Federer, Usain Bolt. They sleep like 9 to 10 hours a day, and they nap. Right? What's her name? Sydney McLaughlin, who the 400-meter hurdler, beautiful runner, Olympic medalist, right? Sleeps 10 hours a day to recover. So it's highly variable. And despite what they're saying, the wearable data that we have, it doesn't measure sleep, it calculates sleep based on a few other parameters. It doesn't measure sleep because you don't have EEG on it.
It's a
There
big
are
difference.
stuff coming up, but right now we can't actually truly measure it. We can calculate it. And so I don't use those numbers very well. The number I do use from wearable data is what is your average sleep length. It's very good at telling you how long you slept for. So if you keep a log and you say, oh, you know what, on those days I actually slept really well, right? You might notice 6 hours is all you need. So you
Okay.
don't beat yourself up because you only got 6 hours because someone on TikTok said it needs to be 9 hours. Like, it is you. It's whatever works for you.
Amazing. And that answer makes complete sense. I'm the same way. I need 6 to function. My wife needs 7 or 8, right?
Yeah, my wife's exactly the same. Yeah.
All right. So this is in regards to the actual testing itself, right?
Mhm.
So you mentioned the ratio between the neutrophils and the lymphocytes. Should should this ratio, should it decrease? Should it increase? I think there was a few questions in regards
Yep.
to what that ratio should look like. And Dr. Suppiah, would you be able to share the slide with the actual panel itself, so that the team or the individuals joining can actually see what it is that you order for the patients?
This one or this one? Oh, this one. Yeah, yeah. Let me do this. Yeah, this one here. Yeah.
Perfect.
Okay. So this is my entire panel, and I think you guys are hooking people up for. I mean, this is how come I don't get this rate when I I don't get this rate. Whatever,
The
man.
new customers only? I'm just
Yeah, I
joking.
just
I'm just joking.
okay. So the neutrophil, the normal ratio is 1 to 3, between 1 and 3, right? I actually want to change it. I actually want to say more like 1.5 to 3. Okay. As the ratio goes low, I'm looking for a drop. I'm trying to see if the lymphocytes are coming up and the neutrophil is going down, or they're catching up. If that gap is getting smaller, right, from 1.5 to 3, if it's getting to like 1 and then it's reversing is really an issue. But like if you're doing, say, monthly biomarkers or every quarterly, you want to see that ratio be around 1.5 to 3. If you see the ratio narrowing, I would start repeating the blood test to see if it's getting to this point and reversing, especially for the clientele I work with, for athletes, right? Because if it is, chances of them getting a viral illness at that point is very high. And this has been so accurate in my practice. I've looked at players and say, hey, you're going to get a cold, you're going to get sick, and they'll get a sinus infection, or they'll, you know, I'm not even telling them. Sometimes I look at them and go, hey, man, you just need to like take it easy a bit. And they're like, am I run down? And I'm like, yeah, a little bit. Just, I don't tell them what they're going to get. And invariably, like, they'll get sick, I see that a lot.
That's amazing that you're able to predict that just looking at
Yeah.
wow, that's incredible. And how often do you test, right, your athletes, or is that customizable to each individual?
As a general rule, I do 2 big blood tests. Okay. Like full stool, I mean, these athletes who can pay for a lot of stuff. So like I do a nutritional panel. I look at all the beginning of the season and towards the second half of the season, okay? Because I want to see we're starting well, and I want to see like are we keeping it well, okay? And then in between those, I do like this profile here just to make sure we are on top of stuff. So I run labs about every quarter. Some of the labs I run, for instance, if you want to measure fatty acids, for instance, it's measured on the red blood cell, or like A1C, right? Like it is measured on the red blood cell. So the half-life of RBC is 90 days. So you don't really, 120 days. So you don't really want to repeat that too often. It's not going to help you, you know? So for me, I do it every quarter they get bloods, but like twice a year they get extensive blood work.
Beautiful. And you also talked about, chronic inflammation, right, a few times.
Mhm.
How are you able to differentiate between an individual who has acute and an individual who has chronic inflammation?
Symptomology.
Mm.
How long have the symptoms been going on for? Right? An acute inflammatory response is also much more. So the way I would tell you, right? Okay, imagine if you got a flu. The symptoms are very sudden, they're very severe, and they're like, or you have an acute gout flare up in your joint. Like, oh my God, like this is acute, right? Chronic is when the symptoms become subtle and they are like just not right. People will say, I just don't feel right. The other way you can do is you can compare the ESR to CRP as well, but I don't find that useful in clinical practice, to be honest. In theory, it does, but it hasn't helped me with my athletes.
Fair enough. So we're looking for the actual symptoms themselves.
Yes.
Excellent. Well, Dr. Suppiah, on behalf of Access Medical Labs, I'd like to thank you once again for such an amazing webinar on performance blood testing and unlocking athletes and their peak potential. Truly has been an honor to spend these last 40 minutes with you, sir. Again, if you could take it back to your site, the website link for those who want to get in contact with you. Excellent. To our audience, if you want to get in contact with Dr. Suppiah, here's his link. And like I mentioned earlier, he is a library of information, an amazing individual. And again, to our audience, thank you for tuning in to another Access Live, where we bring you insight from leading medical experts. Don't forget to like, subscribe, and stay healthy. Until next time, everyone.
Yeah, thank you for having me.
Thank you, sir.